And so thinking about how work is different for everybody, and we all have that different propensity to want social interaction, particularly with that segue into many people working from home. And Hayley, you described that you had a really split workforce where many were on site, many were transitioning to the home working environment. Why do you think social communication is so important, and how did you manage to nurture it when you were working across so many different environments?
I think social communication or social connection really feeds into good work, because it gives you that purpose, that meaning, and that sense of we're in it together, specifically in the COVID-19 pandemic. I know that a lot of people were looking forward to returning to the office when they could, so that they could have those water cooler chats and go and make that coffee and that tea. So what we encouraged to do, our colleagues and our line managers to do, was to make time in diaries for those conversations that matter, but didn't need to have an outcome or a purpose. Because often what would happen is you would phone in to check on a colleague, but at the same time, in the next breath, you would say, oh, have you finished that spreadsheet? Or, oh, we need to get that job done by Friday. It was really prioritizing well-being conversations. And we put together a framework about how to have these conversations, what you should think about in terms of the timing, the location, the kinds of questions you can ask. We also used our pillars of well-being, such as mental health, financial well-being, physical, and our 6 ways to well-being. And we kind of said, ask people questions about connection, about being active, so we kind of gave people some guidelines and some frameworks to work with. What was very challenging for us, though, is we are a distributed workforce. So we had to give the contracts and our colleagues the tools, and then we had to say, you need to take a tailored, localized approach. You need to adopt these tools to work either in a team talk or a toolbox talk or a virtual conversation, but we couldn't monitor that. What we did to support that is deliver our own maturity model, which would be owned by an account manager, and they could then identify areas that they should be thinking about to look after the different areas of well-being. And I've kind of spoken about those pillars, but there's got to be that accountability as well.
Sounds brilliant. And as you were alluding to earlier, it's a continual journey, isn't it? We have to keep trying new things and different things as we go through. Did you hear of anything else, Claire?
Oh yes, and I would echo actually what Hayley said about the way that social interactions often need to be highly localized. And I heard some from across organizations, particularly from people who are in wellbeing champion roles and similar roles, of some really wonderful and innovative ways of connecting people, from have a ring round of different colleagues every week, through to virtual coffee mornings and virtual walks and virtual kind of nature trails. So lots of different examples there. What actually struck me really about was that although the pandemic and having virtual interactions rather than face-to-face interactions definitely presented some challenges, many of the participants that I spoke to said that it also enabled the inclusion of some different people who might not have been included before. That those virtual social interactions brought new groups and new configurations together, and was a real benefit for some. And I think there's something that we can really learn from that in terms of shaking it up a bit within organizations and really supporting different groups of people to get the benefit from social interactions.